In our health lead today, the world marked a sobering milestone: more than 6 million COVID deaths globally. As the pandemic shifts towards a new phase here in the U.S., on average, the country is still using more than 1,400 people to COVID every single day. The number is dropping, along with cases and hospitalizations. And as those numbers go down, New York City today is lifting its proof of vaccination requirement for bars and restaurants and dropping its mask mandates for schools. Let's bring in Dr. Chris Pernell. She's a public health physician. Dr. Pernell, you're in New Jersey, where masks will no longer be required in schools or in daycare. What do you make of this new balance the society is now making? We're lifting more restrictions. At the same time, we know people around us could still get sick. We also know that most of them are not vaccinated.
Thanks, Jake. There are three words that immediately come to mind looking at our situation in New Jersey and just more broadly across the nation: vigilance, patience, and equity. While cases are plummeting, while we have additional capacity in our hospitals because hospitalizations are dropping, we still have to be concerned about those historically marginalized communities, specifically in New Jersey, in New York, Black and brown communities. We saw in New York that even though that a majority of folks were vaccinated and even boosted, those who suffered the worst during the Omicron surge were the Black and Hispanic population. So that's what I'm concerned about here at home. I'm very, very thankful and grateful for the progress, but we cannot afford to leave any community behind.
The CDC director suggested what the end of the pandemic phase of COVID might look like. Here's what she told 60 Minutes. Take a listen.
I do think that we will get to a place with this disease where we live with a relatively low level all year long, and that maybe we have some surges during respiratory virus season. Those surges are annoying, and for some, they will likely be tragic, but they are not to the tune of 2,000 and 3,000 deaths a day. I think we live that way with influenza.
How close do you think we are to the point where we live with COVID the way we live with influenza or the flu?
You know, Jake, there is no magic timeline, and I want the public to understand that. What we need to be doing is tracking multiple metrics simultaneously. While we're watching those case rates plummet, we need to ensure that vaccination and boosting is happening, especially in those groups that I described. Because if a variant of concern would emerge, like Omicron was, where being boosted is fundamental to your protection and your safety, we're going to see that disproportionate impact in those groups. So I would just caution people, yes, we will get to the point where there's predictability, where it's more like the seasonal flu, but we're not there yet. As long as we have a significant portion of the population that's unvaccinated, and that's true across the United States when you rank us among our global peers, and true across the globe, there is a chance for such a variant to arise.
A few days ago, we saw the governor of Florida berating students for wearing masks at an event. It turned out later that one of the students wearing a mask has a relative, an older, I think, grandfather who is immunocompromised. Today, Florida's controversial Surgeon General recommended that healthy children in Florida not get the COVID vaccine, completely at odds with CDC recommendations, which advise children 5 and older, all of them, get vaccinated. What do you make of that announcement by the Florida Surgeon General today?
That anti-science propaganda really is deadly, and we in public health and more broadly in the healthcare community, we need to stand up and push back with quite a bit of pressure against that, because we know that anti-science kills. We look at the number of Americans who are not vaccinated in rural areas. We look at the number of Americans who are not vaccinated and boosted in certain pockets of racial and ethnic groups, and we cannot afford to allow false information such as not wearing a mask is not helpful to continue to be proliferated. And the last point, Jake, is that we know that any COVID infection can lead to long COVID. And as long as that is true, we need to be doing what is in our best interest to prevent all COVID infections.
Dr. Chris Pernell, thank you so much. Appreciate it.